We begin by discussing the process of transitioning into the clinical nurse educator role, or more specifically, transitioning without an orientation process, which is the norm as I previously mentioned. When starting a new clinical nursing position, we usually go through an orientation process for at least 2 weeks, depending on our past experience and the new position or the clinical unit. This is not what happens in nursing education. You see, most nursing programs provide very little orientation beyond perhaps a PowerPoint presentation, going over the highlights of the program's policies, if you're lucky. And you receive even less when you begin as an adjunct clinical instructor. There seems to be an expectation that you already know how to teach. This is why I recommend you begin by asking for a copy of the entire program's syllabi, program policies and procedures, as well as the expectations and policies and procedures for students. You will need to know these inside and out to ensure that you are holding the students equally accountable. The process is much smoother when you have a mentor, which is why I've included a short mentoring module. You'll learn about mentoring from both perspectives, as a mentor and a mentee, as each person has responsibilities in the relationship. As a new instructor, I recommend that you take kind of a middle of the road approach, neither being too needy or too solitary, as in going it all alone. In keeping with evidence-based practice, you can expect to learn about teaching and learning theories most often utilized to support your clinical teaching strategies. You'll also explore the code of ethics for nurses, trust, and incivility as it relates to clinical teaching, as well as FERPA, which is the Family Education and Rights Act, or Privacy for Students, which is a federal law specific to academia, something that we don't deal with at the bedside. In the second course, it's all about teaching the clinical rotation, from how to prepare yourself and preparing the student evaluation. You will discover different strategies for making student assignments, conducting pre- and post-conferences, how to facilitate student learning, not supervising them, how to give student feedback, and strategies for teaching clinical judgment. You'll also have access to a toolbox of clinical teaching strategies. So, do you want to feel more confident when you're teaching? If you're already teaching, do you want to be assured that you're already on the right track with your teaching? If you want more information, check out my website and consider registering for the self-paced online program. I'm here for you at clinicalnursinginstructor.com. Thank you.